Hello, and welcome to another Psyche Innovations webinar. It's great to have you with us in the end of October. And as always, with all our webinars, we'd love for you to engage with us and leave us lots of questions in the chat that we can potentially answer as we go. And if we can't get to them in the session, we'll try to answer them afterwards. All right, so without further ado, let's jump in. So today's topic is adolescents in crisis, trauma across contexts. So there might have been a little bit of confusion for some of you, as we had a guest who unfortunately couldn't make it because of personal reasons or personal emergency. So we have an amazing guest who we were going to have in the future anyway, step in for us. So who is this amazing gentleman? It is Wiehan Basson. Wiehan is a clinical psychologist. And I'm now going to tell you a little bit about him and his background. So as a clinical psychologist, Wiehan aims to continuously utilize and refine the knowledge and insights he accumulated through volunteer and professional work and training to improve the efficacy with which he provides the diverse South African population with opportunities for support and corrective emotional experiences in recognition of the multiplicity of historical and contextual challenges that complicate the therapeutic landscape in South Africa. Wiehan values self-reflection and close collaboration with both clients and other healthcare professionals, hence him being here, to help deliver holistic understanding of and comprehensive treatment approaches for each unique person that works within the boundaries of the broader contextual dynamics that may affect their well-being. Wiehan has been involved with emotion aid, doing psychological first aid, in particular with Ukrainian refugees. He's also been involved with the Trauma Center and Counseling Hub, doing group and individual counseling in underserved areas. And Wiehan and I work together as founders of the Positive Youth Development Foundation, which does group-based, evidence-based interventions with low-resource communities, with young people and people with disabilities. So thank you for being here, Wiehan.
Thanks for the very long introduction. And in short, I guess I could just say very happy to be here. And sort of just for the sake of interest, Daniel actually tutored me back in my first year. So sort of full circle coming back and being on your platform. So thanks for having me.
No, man, it's been an absolute privilege being part of your journey. And thank you for making me look old. All right. So for those of you who don't know who I am, I'm Dr. Daniel Page. I'm the CEO of Psyche Innovations, and I'm the host of this webinar. So my background is in molecular biology and psychology. I studied at Stellies, which is a South African university. As I mentioned, I was involved with the Positive Youth, or am involved with the Positive Youth Development Foundation. I did my doctorate in psychological skills, which is kind of my expertise, and I've worked in all sorts of international projects. So please engage with us afterwards. We're really looking forward to that. So what is Psyche Innovations and what do we do? We're a digital and human-centered mental health company, which is all about creating resources for young people and adults. We do this chiefly through our mental health app, which is called the Psyche Mental Health app, and we provide our services to individuals, mental health practitioners, and organizations. I really encourage you to go check that out after the webinar. Right, so our whole approach is about holistic mental health and well-being and using evidence-based approaches and being holistic, and we like to get global experts on to talk about these kind of points, and hence why we do these webinars. Right, so let's jump straight into it. I have sort of prepared some questions for Wiehan just to sort of kick off a discussion. And as I said, please provide us your questions and comments as we go to add value. Right, so Wiehan, based on your experiences in South Africa, how does trauma shape an adolescent's sense of self and their ability to trust others?
So I'm going to try to not be tangential, but as you know, Daniel, that can sometimes be challenging. But I think, it's important to maybe just start with just a sort of a basic definition, and I'll sort of refer to the Diagnostic and Statistical Manual's definition of trauma, that it can really be any sort of either direct or indirectly experienced event that's, significantly stressful. So it can be actual exposure to actual threatened death or serious injury or sexual violence. And as we know, it's very common, across the world to experience trauma. So adolescence is already a very critical sort of developmental period, especially when it comes to identity formation and sort of trying to differentiate yourself from your family and from others. So if an adolescent's experienced trauma, whether that be a single event or multiple continuous trauma, that's more complex, it's going to have a significant impact on how they're experiencing themselves, others, and the world. So we can see that in different ways in which different individuals may respond. But we're looking at, alterations in their cognitions and their mood. We're looking at different, manifestations of the trauma that's sort of re-experienced by the individual. And all of those can accumulate into syndromes that we commonly call disorders, such as post-traumatic stress disorder. And very commonly, those are comorbid with anxiety and depression, and often also substance use. So there are various ways in which experience of trauma, especially during adolescence, can impact an adolescent. And I think it's very important to be mindful that it's already such a sensitive developmental period. I think everyone can refer back to when they were a teenager themselves, that you're already navigating a lot of change and physiological change and psychological change. So to then experience something that is essentially overwhelming for your nervous system is going to significantly impact your further development.
Yeah, that's awesome. When we think about trauma, like, what is trauma, and how is trauma different when it affects adolescents versus adults?
So, like I said, the trauma in terms of the DSM can range, vast different types of trauma can be experienced. But it essentially, at least by the clinical definition, is that there has to be direct or indirect exposure. So either witnessing or experiencing itself, or seeing, a traumatic event occur for someone close to you, like a family member or a friend. And often it, takes the place takes the form of physical violence or sexual violence. But when we're not looking at sort of what's referred to in the field as, capital T traumas, and just look at sort of more everyday traumatic events, that's not necessarily clinically traumatic. Something for an adolescent, such as their parents going through divorce or changing schools, that can be traumatic in itself. So I think it's important to sort of also try to look at the individual that you're obviously engaging with or trying to support, and trying to understand how they've experienced this untoward event. So I think it's important to try and also look closely at, for each individual, how they respond to whatever has occurred with them or to them or someone close to them, and then try to sort of navigate the process based on that.
For sure. So trauma can be very varied in type, intensity, and a young person's experience of it can also vary greatly. South Africa, obviously, there's a lot of different types of trauma, especially for young people in more vulnerable situations, potentially living in poverty or in child-headed households. There's fewer resources for them to draw on. So that kind of makes me sort of lead to the next question. What are some of the common emotional and behavioral patterns you see in traumatized adolescents, and how do these present differently across cultural or geographic contexts?
I think it's a really important question, and ties into other aspects as well. So I'm going to try and stay on track. But I think in terms of how it may manifest emotionally, and again, this will be different from person to person, context to context, but common patterns are completely emotionally withdrawing from close relatives, from family, from friends, trying to isolate, and it's often as a response to try and avoid any reminders of the trauma, or due to sort of a global change in perceiving the world and others as unsafe, so therefore trying to protect themselves. Or it can be sort of the inverse of that, where someone becomes extremely emotionally expressive and sort of project a lot of that internalized experience onto their world and surroundings, or others as well. Behaviorally, we often see the hyperreactivity or hyperarousal when someone's been exposed to trauma, especially adolescents. They can become much more irritable, angry. Like I mentioned previously, depression and anxiety is often very comorbid with someone who has unprocessed traumatic experiences, and ways in which a lot of adolescents try to cope, because they often lack the emotional skills necessary to be able to regulate themselves and sort of process and work through those experiences, often they cope through using substances. So essentially try to, again, avoid, suppress, numb those experiences, the re-experiencing of the trauma, the distress that they may be experiencing internally as a sort of lasting impact of that traumatic event. I can't remember the second part of the question.
No worries. I just want to kind of build on what you said before I ask a follow-up. So essentially, the way they present can vary quite greatly. I suppose that's influenced by their age in the adolescent period. And then the coping strategies that they use can be, some can be very healthy and some of them can be harmful, substance use or risky sexual behavior, becoming violent or whatever, and engaging in activities that are maladaptive. So their experience of trauma can vary, their individual resilience can be quite different, and then how they deal with it can be very different. Why?
I think that's a really good question and rather complex, but there are many factors. I think starting with sort of how we know what we know and how we learn how to survive in this world. And a lot of that comes from very early on in our development. What is modeled to us by our primary caregivers or the people closest to us. And if we're thinking specifically, say, in our South African context, where there's often very cemented intergenerational patterns of trauma where, say, the parents, there's maybe domestic violence in the household, and the child observes that if someone is angry, this is how they are expressing that emotion, this is how they're trying to regulate themselves by, projecting that and sort of directing it at a close other. That often becomes an unconscious way that adolescents may also then learn to express and act out on some of those feelings. Or the converse, where they completely withdraw, trying to sort of reduce stress or harm for the family or for themselves. So I think there's changes from that, the individual's genetic makeup, sort of whether they have other comorbid sort of neurodevelopmental disorders or other challenges or physical disabilities, or just even the context. If there's a context that's severely impoverished, the way in which you're going to respond and manage sort of exposure to traumatic events is going to differ significantly just based on what is sort of the social norm or the cultural norm. So I think in our South African context, it's often very normalized. Children before the age of 10 have often experienced directly, a murder or something of a similar sort of traumatic nature. And that's been normalized where, that is not seen as something that requires attention or requires intervention. So often, I think, before adolescence even, children have it's almost a template of what the world that they're surrounding and developing in might look like. And it's often one that's not very optimal for their development in very unsafe contexts.
Yeah. So the nurture side is the context that they grow up in and how their primary caregivers model certain behaviors that are positive or negative, that then ultimately leads to sort of some of their coping strategies and how they deal with trauma, and also I guess some of the trauma that they're exposed to. And then there's the genetic side of their health and well-being that ultimately affects neurotransmitters and to a degree resilience, and so all those factors interplay with each other. How does that obviously complicates the cultural interpretations and diagnosis? So how does a practitioner deal with all this complexity when they're trying to do diagnosis and manage all those cultural interpretations?
Yeah, I think that's a really valid question, and something that I've come across quite a bit in practice, especially at our primary healthcare settings, where often the time and the resources are severely limited in order of doing assessments and screening and diagnosis. And there's been many a child who gets referred with an existing diagnosis of ADHD because the teacher, where often at school might be the first environment or context in which there's sort of comment made or someone has noticed or observed that something has changed about this child's behavior, and maybe it needs to be looked at. And very often then it's a comment about inattention or they're not doing their schoolwork, and it can very easily, these kinds of signs or symptoms can very easily be just interpreted at face value and then seen as, okay, they struggle with attention, not sitting still, they're acting out, they're getting into fights, they must have attention difficulties, get a diagnosis, get put on medication for that. Whereas if you spend time and you attune to that individual and you actually try to unpack and understand, but why has there been this change? And also why now, which is a very important question to always consider when you are making a diagnosis and doing an assessment, is to think about, what preceded this, and is there potentially a different explanation? For instance, with trauma, there's a lot of research that we know that it impacts on your executive function, impacts on your ability to concentrate and focus, due to re-experiencing, due to the hypervigilance, the acting out, as I've mentioned previously. You often see children then become more impulsive. So a lot of signs and symptoms can mask and result in misdiagnosis because of the way in which, on a tick box approach, sort of it manifests as the same symptom, but we always need to consider, like you've asked, the why. Why is the symptom presenting and what is it really trying to communicate? Because when it comes to adolescence, I think sort of a good point to always start off with is thinking about every behavior or even inaction as a form of communication. Often, we have not yet developed the vocabulary or the insight or capacity to be able to understand what's happening and why we're doing certain things. And that then is sort of what we need to try and help someone to understand. And I think collaboratively unpack with an adolescent to try and understand why they are acting the way they are, and what has changed. And then often we'll see that there may be different root causes than just what the symptoms are presenting as.
Sure. So essentially, how well we help adolescents deal with trauma influences not only their presentation and diagnosis now, but the outcomes for their health long term and how that kind of evolves into their adulthood. At least that's what I'm taking from what you're saying. And so then when I think about adolescents, they have reduced agency over their life. They're reliant on their parents. They have less access to resources. Their brain isn't fully developed yet. So it kind of makes me think about how does stigma and societal views of mental health particularly affect adolescents, and what are some of the biggest barriers that adolescents face when trying to access support or mental health care?
I think, again, really important questions, and I'd like to hear your thoughts as well, because you've led a lot of psychological first aid groups with parents, adolescents, teachers alike, and I'd like to hear your take on it. But I think some of the most common barriers that I see is that there's often, firstly, not even an awareness of access. To give you an example, we have such limited resources in our country. When I did my internship last year and I was placed at a clinic here in the Western Cape, there hadn't been a psychologist there for 3 years. So the waiting list was 150 people, been referred from 2 years prior for intervention. And many of those people were then unable to access resources that they really needed at a critical time to prevent that long-term sort of adverse impact that we know can result from exposure to trauma. And I think something that prevents a lot of people from accessing that is awareness that there's such limited resources, that also kind of produces, a sense of hopelessness, or knowing that they're going to be on a waiting list for so long. By the time that it is their opportunity to access services, it's sort of long past the crucial period where they may be required intervention. So I think limitations on access, the idea, especially among men, that we're not allowed to express emotions and talk about things. We need to just suppress and bottle and fix. I think there are many ways in which, across different cultures as well, which we are socialized to try to sort of keep things inside because of a lot of shame and guilt and judgment, rather than developing capacities to become more curious about what we are experiencing and why. Always try to sort of recommend to people is to try and approach others and themselves. It's harder said than done. I also still struggle with that. But to rather ask, why am I doing this, rather than why am I doing this? Because we tend to gravitate towards that judgment and criticism, but it stops us from actually reaching depth and insight. So to throw it back to you, because I went on a tangent, but what are your thoughts on the need, and I think especially in terms of helping adolescents who've been exposed to trauma sort of manage these longer term consequences in this under-resourced country that we find ourselves in. From your experience, what do you think might be valuable or useful to try and provide some support or create some opportunity for intervention?
Yeah. Well, I think as a starting point, when we think of stigma, adults are heavily affected by societal norms and beliefs, and adolescents, when they're trying to form their sense of identity and group dynamics, are so important. Stigma affects them in a huge way. It can prevent them from taking healthy behaviors or accessing resources even when they're there, because they don't necessarily see the need. And to kind of build on something else you were saying, there's a degree of self-reflection and empathy that's needed to care for ourselves and to care for other people, which is hard to develop and is hard to practice. Then when we think about barriers, as you were talking, a memory sort of popped up for me where you told me when you were volunteering at one of these places, I can't remember which one it was, you were saying that you were trying to catch up on a backlog of people who hadn't received services, and you phoned somebody, and I think they'd been on a waiting list for like 3 years, and the guy or the person on the other side of the phone started yelling at you because they were like so upset that like what they had to deal with had already not necessarily passed, but like they were just frustrated. And I think, look, that's an anecdote, but that's the reality, is that governments and hospitals and providers are trying their best to meet the demand, but there isn't. And that's particularly a huge challenge for young people, because they don't even know that there potentially are services out there. What is a psychologist? What is a psychiatrist? How do I get to a clinic? If I think of myself at 16 or 15, you have no car, you don't know how to get anywhere. What is mental health really? So what do we do with that? And to me, part of the solution is psychoeducation, and that is a broad umbrella term, and there's a lot that can be done there. But if we bring it back to focusing on adolescence, and especially the trauma that is, individual experiences are repeatedly experienced in South Africa in numerous different ways, I think psychological first aid has a particularly valuable approach to take. Because PFA teaches some of the core aspects of mental health literacy, as well as supporting somebody after a traumatic event. And it can be quite quickly taught to teachers and healthcare providers, and really anywhere that young people are regularly interacting.
Like that first line often of individuals who actually might be the first time someone shares that they've experienced a trauma. Often I think different people in the caring professions, especially teachers, I think as well, they're often the first person who is experienced as safe enough to share that someone has actually experienced something very untoward. So I think it's so valuable for us to try and empower lots of different stakeholders, not just professionals in the mental health field, because the access is limited and restricted to us. So I think that's really valuable in trying to just start doing a bit more prevention, because we are unfortunately, and this is just my opinion, but I think we are unfortunately stuck in a cycle of trying to sort of treat old wounds, which has been intergenerationally passed on, especially in our country. And a lot of the dynamics are very engendered. And it's going to take a long time to try and undo and unchange that and develop more secure attachments within and beyond families as well. So I think unless we start also trying to be proactive and prevent further injury, we're constantly going to be sort of behind the curve rather than trying to push, which I think it's not as intuitive. I myself have very seldomly encountered someone who has sought out, from their own autonomy agency, sought out support, unless they've reached a level of crisis or distress where they actually can't function anymore. So, and that's something that I experienced as a registered counselor previous year as well, which, that scope of practice of mental health professional focuses more on primary intervention and prevention. But often it was the case that I would have to refer out to someone who's more experienced, who has a larger scope of practice, because people tend to not present when they've just struggled with, anxiety for a bit, or they struggle with their sleep, or they haven't been feeling great. They tend to wait until it becomes a crisis. And I think, again, to bring it back to the stigma, I think that's a big part of that. It's so stigmatized, our mental health in general. No one bats an eye if someone says that they're taking medication for their blood sugar or for their heart. But if you hear someone say that they're on antidepressants or they're taking medication for, whatever kind of mental health disorder they may have, immediately there's a sense of judgment, or a sense of, I don't know if it's uncertainty and familiarity, but it's something that I think is going to take a long time for us to address. And I think starting with things that are, for instance, preventative and proactive, and psycho-educating people that we all have mental health. It's as vitally important and more intertwined than I think we recognize or necessarily appreciate in our country, that our physiological and psychological well-being is so intertwined. So I think paying a bit more attention to that, and just helping to create awareness for especially adults who can help step in for adolescents, who, like you've mentioned, often don't have the agency or the autonomy to sort of, or even just the insight, or, haven't necessarily developed the critical skills to think about the longer term consequences, and they're more focused on fitting into the group, what brand shirt I'm going to wear, whatever is going on for them in that moment. So I think it's really important, and definitely would endorse that.
Yeah, I agree. There's an upstream thinking of promotion prevention that needs to happen, so that we can sort of narrow the funnel of people needing more specialist care. And that's true for physical health as it is for mental health. We think about exercise and nutrition campaigns to reduce the number of people who need a heart surgeon, right? And everyone's like, yes, that makes sense. But mental health, there just really isn't much done. And often it's thought of very last minute as a sort of like Band-Aid on a huge foundational crack. And even if somebody ultimately still needs treatment because of life or, whatever, doing promotion prevention work and building resources, building resilience can also help people access care sooner, more appropriately than waiting very last minute. Because mental health comes with, a lot of people have like internalized shame, and they're like, oh, should I really be needing this? And, and like, I'm not saying all of that can be addressed with psychoeducation and promotion prevention, but it can definitely create a snowball effect that can kind of improve things. And that sort of leads to some of the questions that we've got here. We have a very detailed question around physiological impact of neurochemical effects of big traumas. I think that can be better addressed by Wiehan afterwards in a nice detailed answer. So apologies for skipping that. And then we sort of have a question here around today's youth, or a chronically online generation. What does the future of online mental health resources look like? And a follow-up question around, can digital mental health tools improve access to mental health resources for teens? And what considerations need to be made regarding cost and internet access? Wow, those are good questions. So obviously we're a digital mental health company, and people will often say, like, why create an app? Why create a resource for young people when there's the internet? Like, people can Google anything, or they can use ChatGPT. Fair, but also not fair. And the reason for that is that exactly. The internet is much like social media. You can go on TikTok or Instagram and find somebody who's really well informed and saying something that makes a lot of sense. But is it appropriate? Is it evidence-based? Is it easily accessible? Is it trustworthy? Does it have all the legal protections in place? Has it been designed with young people in mind? And the answer to that question is often no. So I think with all resources, you can poke a hole in anything, and there's no silver bullet. So like, one of the biggest criticisms is like, oh, but some people don't have phones. Yeah, true. But, more people have access to smartphones than toilets in South Africa. So my approach, and I think anyone who thinks about it long enough will see that what we need to do is increase the availability and quality of mental health resources and care. And digital interventions and tools have a vital place in that care, whether it's an individual, a young person accessing it by themselves, or with a mental health practitioner between sessions or in sessions. It can add a lot of value. Or in humanitarian settings where there isn't a lot of formal care, as well as in organizations, whether that's a school or a university or a business. We kind of reach people where they are and give them the right tool at the right time. And another thing that we have to think about when we think about resources is what is the minimum required therapeutic dose? To make that kind of simpler to think about is when you have a headache, like how much Panado or paracetamol, for those that don't know what Panado is, how much paracetamol or a pain medication do you need to treat your headache? And that varies person to person, depending on your size and your age and all these factors. And that's really the same with mental health resources and in particular psychoeducation. The treatment's different, and I'm not talking about that. But sometimes what's required is a resource is simply directing them to a helpline. And that can save somebody's life. It might be them doing an assessment, identifying, maybe I'm not doing so hot, and that encourages them to take another behavior that help, reach out to a primary caregiver or a friend or somebody in their community that's responsible, somebody in their faith, somebody in their sport realm or whatever. So these resources can do a lot by providing them with the help to take the next step that's often required. And of course, there's a continuum of care, right? We don't want to be over-pathologizing people and directing them to the most complex, high form of care that they don't necessarily need. Not everyone needs a professor in psychiatry to treat them. So those are kind of the things that we think about when designing digital tools. Is it appropriate? Can they easily access it? Has it been built with them in mind regarding cost and availability? And now I'm turning into the and rambling.
And I want to add to your ramble then, just by giving an example of, I worked recently with an adolescent, and we only had two very brief, it was actually pretty much just intake sessions. We haven't really started with the therapy portion, and there was a base for sort of an acute trauma that they experienced, and just the psyche education helped them to feel so contained. They didn't come back to therapy. That was left up to me to think, okay, well, is it, did they not want to finish the intervention? Did they feel that they sort of met what they or got what they wanted from it? And then got feedback later that year that they had sort of remitted. So just understanding, because often I think it's such a natural response for us. We go through something, we start struggling, especially because mental health is not as physically manifest. It's not always as observable, as a broken arm, for instance, that I think often people then rather judge, hide, suppress. And that's often then where the difficulties start coming, because of the ways in which we're trying to, respond to this internal distress. So for instance, the specific individual, they thought that they were going crazy because they were starting to, see images of the trauma reoccur, and it's just to explain to them that that's actually a completely normal response to a traumatic event. And that experience could not be sort of placed in terms of context and time and filed away into long-term memory. So now it's kind of just being reactivated in the present moment and re-experienced. And that helped them to feel like they, in their words, not going crazy, and was a sufficient intervention to help someone who very likely, prognostically, without just that bit of psychoeducation, would have developed, full-blown PTSD, and likely experienced other adverse consequences. So I think psychoeducation is so powerful.
Yeah, 100%. And that's one of the core sort of outcomes of trying to do psychological first aid, which is kind of like in the realm of mental health promotion, prevention, early treatment, is to intervene early to try reduce the likelihood of long-term negative mental health outcomes. That is kind of one of the key reasons why it was created. And that kind of links a little bit to one of the questions we have here, which again, I'm volunteering Wiehan to answer in more detail afterwards, which is around, can undetected conditions such as ADHD and autism also not lead to trauma due to repeated misunderstanding the child might experience? So from my perspective, I hope Wiehan can answer. But yes, being diagnosed late and not receiving treatment and care at an appropriate time, much like with physical health, if you're running around on a broken leg and it's not being treated, it's likely to exacerbate it and lead to coping mechanisms and maladaptive behaviors and reduce quality of life. I think that's also the thing that we sometimes forget is people say like, oh yeah, but I can kind of like suffer through and I'll manage and I don't need care and I don't need resources. And my argument to that has always been, if you could be happy and healthier, whatever that means to you, why would you not try? And that for me is true whether you're needing and busy accessing treatment or you're looking at more self-development, promotion, prevention kind of tools. I'm curious what you think about that. Yeah.
Yeah, no, I definitely do think so. And again, I think just sort of differentiating, that capital T trauma versus other kinds of very, very distressing and often sort of more chronic re-experiencing of stressful events. And I think it's very well encapsulated in someone, for instance, who has been labeled a specific way because they were misunderstood. And that reinforces then a very self-critical, identity and belief. And, a child who's constantly told that they're naughty is going to end up acting out, in that way, sort of the self-fulfilling prophecy, because any attention and attunement is still attention. So we gravitate towards what's familiar. And I think often you'll find that, when someone is starting to be understood in a different light, there can be a significant change internally for them as well, just because they've not been able to sort of attach or attune to someone else externally, in the environment or in the world around them, who's not perceiving them through that same lens and is giving them an opportunity to then sort of, reassess themselves in a new, less judgmental, a more curious light. And I think it can have really, really positive impacts.
Yeah. There's another question that came through, which actually kind of couples nicely with another question I want to ask Wiehan. So the question is, can undetected trauma lead to ADHD and autism? So I'm going to tack my question kind of onto that, which is, what does recovery and resilience look like for adolescents in contexts where therapy or care might not be readily available or socially acceptable? And when you answer that question, I'm curious about potential negative outcomes, sort of the why and how, as well as the potential positive, because I think it might be easy to get locked down into just thinking about the negative, but there is, people can be resilient and there could be more positive outcomes. So I'm curious about that. What does recovery and resilience look like in adolescence?
Yeah, I think, maybe just firstly to address that, the question that was posed about sort of development of trauma. So conditions like ADHD and autism, and those are neurodevelopmental disorders, and they originate through the initial developmental phases where you are in your earlier stages of life. So there's a lot of genetic contributions, and there are also environmental factors that can attribute to that. So I think there'll be differences in opinion about that, but for instance, your parents and their exposure to trauma will have a significant impact on your likelihood of developing a neurodevelopmental condition. Also, just whether they have a neurodevelopmental condition or not, because we know there's a sort of a genetic component that is hereditary with neurodevelopmental disorders. But to get to the question around recovery and resilience, I think, firstly, I think not to discount the just immense resilience of people, just people in general. I've been privileged in some senses and also challenged in many senses to be privy to explore alongside and sort of get to experience with others very distressing, very traumatic, very difficult experiences through the work that I do. And yet the positive side to that we often don't talk about is the post-traumatic growth, or the meaningful change and growth that comes from experiences of trauma. People recognizing what they're actually capable of withstanding, and often sort of growing as a result. And often, and it might be controversial to say, but being grateful, not for the experience in itself, but for the process of growth and change and the insights that come from that very untoward and unwanted experience. So I think, and that's, possible without interventions too. I just think that because of contexts that are rife with trauma and limited access to safer spaces and secure relationships where, difficult things can be unpacked and explored and sort of made sense of or meaning made out of, I think that unfortunately sort of spontaneous recovery or full returning to full remission after, developing a significant or clinical post-traumatic response is quite unlikely. And we more often see the negative outcomes, such as, individuals turning towards substances to try and numb and suppress those feelings, or becoming very avoidant, and becoming very reactive in their responses. They may withdraw from everyone in their lives, but at the drop of the hat, they may become very explosive and reactive towards others. And I think in contexts where there are these examples of perceived safe spaces, for instance, gangs, belonging, you spoke about group identity and cohesion earlier, I think often they become attractive for young individuals who may not have any sense of safety in their home environment or with their primary caregivers. And they often gravitate towards those environments that are perceived as offering some form of safety, but again, being exposed to more violence and aggression, they sometimes can develop an appetite for aggression, specifically because that's the sort of reliving and re-experiencing of what has been internalized. That becomes familiar, so that it's actually a means to try and maintain sort of some sense of internal stability. Because if I'm always exposed to in this sort of unsafe and hypervigilant state, then I can recreate that and feel like I have some control over my environment rather than my environment controlling me. So unfortunately, that is something that we see more often, children or adolescents rather, either feeling like they're completely controlled by the environment and becoming extremely permissive, and then also more vulnerable to exploitation or abuse and further sort of traumatic events, or alternatively, them trying to assert control over the environment, and then often, running into sort of issues with the law or, other peers or adults, and that's when we often see the defiance and sort of conduct-related issues also coming out. And often when you do a full intake or history of someone, you'll find that it's unlikely that you're going to see someone who is, going against the grain in every way possible and experiencing a lot of untoward consequences themselves, if there weren't some sort of event that robbed them of their sense of autonomy somewhere along the line. Don't know if that answers the question. I went on a tangent.
Yeah, no, it does. There's sort of like myriad sort of outcomes for young people and adolescents that experience trauma or, suboptimal upbringings. I don't know if there is such a thing as an optimal, but approximating it.
That's debatable.
And yes, debatable. And I guess the thing I take from it is it's society's kind of job to create as positive, supportive environments for young people as possible, to break cycles of trauma and oppression and all those other bad things that lead to unhealthy behaviors and mental states and potentially mental health conditions. And that's going to take public health, it's going to take education, it's going to take private industry, it's going to take companies and whatever working together, in my opinion, to make sure that we're providing promotion, prevention, and treatment as best as possible to as many people as possible.
Collective
that's
approach.
Along that whole continuity of care. And I think the approaches that could and should be explored is leveraging the resources that we already have, upskilling people through things like mental health literacy workshops and psychological first aid, and strengthening professional groups. And I think there's a comment here around, does this mean government is the one holding us back in increasing access? From training psychologists in master's degree and all the red tape and bottlenecking. Yes, and it's part of the problem.
It's a
It's
very large, very complex problem, and I think, sorry to jump in, but I do think that we have a tendency to want to sort of oversimplify the complexity of whatever the challenges we're facing, just as a means of trying to wrap our heads around it and feel a bit of reprieve from the discomfort that comes with uncertainty. And I think the reality is that if you are really attuning to an individual, no person, no adolescent who's experienced a trauma will have the same response. We've seen that in very robust studies as well. We've looked at, identical twins and their responses to trauma and how that can differ. I think that it's important to bear in mind that if we can try as a country as a whole to create more safe spaces, that's the ideal. But in practice, it is very difficult to do, and with the red tape around training more practitioners and the costs, I think our country and our institutions, at least as far as I'm aware, are trying to improve access, train more professionals. But the complexity of people, human behavior, is it's complex. So hence, it's not something that you can just wrap your head around quickly. And I think that it can be quite dangerous in terms of if we simplify things and explain it away as one thing causes another. And that's often when we get to, for instance, the misdiagnosis, because on the surface level it may seem that way, but investigating sort of more closely for this specific individual in this specific context, what's in their best interests, and trying to find that out collaboratively with that person, I think is key to really looking at how can we try and improve their reality, because that's sort of where I'm stuck, I think, is also sometimes feeling a little bit burdened by the lack of resources and things in our country. But it doesn't negate the fact that we can all, regardless of your professional training and registration, you can still have a very meaningful impact in another person's life just by attuning to them and really listening, not fixing, not resolving, just listening and being with them in whatever it is that they're experiencing.
Yeah. The whole correlation doesn't imply a causation argument. And I think it's an uncomfortable answer that the solution to the mental health crisis we're seeing globally, and particularly in relation to young people, there is no simple silver bullet answer. And it's frustrating because people want to see change for society, but also for themselves. A lot of us experienced hardship and trauma, and now we might not have got the care that we want. So we're trying to, fix the world in some shape or form. So it's a very frustrating process at times. And yes, there are inefficiencies and whatever. And I think having these kind of dialogues about raising awareness about the importance of mental health, it's slowly building. We're not the first. We're not going to be the last. We're all kind of working together to try to do our bit. I'm in the promotion prevention space, and Wiehan's in treatment, and it's a sort of shared mission. And I try to, in these webinars, focus on kind of like what's the current state, what's kind of key knowledge that might be necessary, and thinking about how these attitudes and beliefs around these challenges affect us all. And like we're getting all these fantastic questions that we'll answer, as many of them now, but afterwards as well. And then focus on, well, what can we do individually and as a society? Because we know things like there's lack of service provision in the country. So what do we do with that? And part of that is because of lack of budget going towards mental health service provision, especially in the promotion prevention space. So, by raising awareness, we can make more informed voting decisions and try to affect policy and get government and health departments or whatever to change approaches. That's constantly what we're all trying to do, I guess, and what we should be aiming for.
Perhaps, Daniel, I can ask you, because I'm also curious from your perspective, and obviously wanting to incorporate, technology as a means to try and affect some change, especially in the prevention and promotion space. How do you think technology can be used in terms of trying to support adolescents, that have been exposed to trauma, or maybe repeatedly exposed to trauma, especially in our under-resourced settings? Because I think that's the majority of our population in South Africa.
Yeah, sure. So what role does technology play in helping under-resourced environments? It really depends, and that's an annoying answer, but the reality is, unless somebody's turned you on to the idea that there is help or there is a solution, you don't go look for it. Like, you don't think when you're carrying something heavy to use a wheelbarrow if you have no idea that there is a wheelbarrow or what a wheelbarrow is, which might be a silly example to use, but that's kind of the reality. So a tool's only useful if it's in the right place at the right time and people can access it. So part of our role as a company and as digital health companies or governments that make these kind of tools, part of our job is building the awareness and putting the tool in the right place at the right time. And that's tricky, really designing with the end user in mind. And then, just continuously iterating and trying to provide the most valuable resource that provides the most value in the shortest period of time, because we live in a world that's busy and like how do you create a mental health app or digital tool that can compete with TikTok or YouTube or Instagram or whatever? Man, it's hard. And that's the challenge, right? Is to change the zeitgeist, the overwhelming sort of philosophy around how we should be approaching self-care and mental health as a society. And part of that is education, and part of that is service provision, and part of that is collaboration, right? This is going to sound very hippy-dippy, but I think solving the problem is through working together. There are nonprofits that are in communities working with young people already. For us or anyone to enter that space, it's difficult. But if we can empower those nonprofits with a tool or resource that builds on what they're already doing, then we're amplifying impact. We're also potentially spreading their reach. Exactly, their reach. So we're increasing their impact. We're increasing their ability to provide quality evidence-based services and to measure outcomes. And that's ultimately what we're trying to do. And I think digital mental health companies are trying to do in general. The challenge is creating a model that works in achieving that, because and this is me wearing my entrepreneur hat, also having been in research and also having been in the nonprofit space, is nonprofits are reliant on grants and government funding. So it's all about sort of numbers, and the end user doesn't pay, which in some ways is a good thing, in some ways is a bad thing. And then government is all about size. So it's all about, creating these huge departments, and there's a lot of inefficiency there. And then obviously in for-profit companies, it's, you have to focus on profit. You can't survive as a company if you're not selling something. And in all of these, the incentives for what we're trying to achieve is different. And trying to, it's easy to say we should collaborate, but creating an environment where you're working with government and you're working with nonprofits and you're also for-profit to draw on the strengths of each, that's hella difficult. We were talking about the red tape of service provision earlier. It is complicated. I bang my head against the wall many days trying to deal with that reality. And it's easy to say, like, people can point at many problems in the world and be like, oh, there's these humanitarian settings, and like adolescents are very at risk of mental health conditions, and we could spew stats, and that's often what happens in these webinars. Like, you have these academics and they'll say a whole bunch of statistics and whatever, and like it's hard to solve the problem because there's so many barriers in the way, and that it takes a lot of consistency and money and effort to reach, which seems like a lazy answer to give.
No, it's appropriate. It is, you know, and I think that trying to utilize, for instance, just the platform, you know, like using an app and something it is a starting point, I think, to make mental health more accessible. I think that a lot of adolescents are more likely to, you know, have a first encounter, or to be more comfortable with the first encounter, say with mental health in general, via app. It's private, they can be in their home, you know, it doesn't have to be as public as a lot of individuals have to, you know, go to a physical clinic where there's hundreds of people waiting that they may know from the community, and who they need to explain, well, why are you here? So I think that, you know, there's a lot of pros and cons, and personally, I think that it's, like you said, it's very challenging to start start getting the wheel rolling in terms of what I also believe is necessary, having more primary focus and trying to start building a healthier generation of you know, young adults, rather than merely focusing on trying to treat sort of people who've already suffered a lot. But I think that what has maybe contributed and made that unpopular is because, like you said, you might not necessarily be able to see immediate you know, improvements or things, because we're trying to prevent it from going bad in the first place. But I think often on paper, especially for funders and things, that's the issue. They want to see stats. They want to see how many people have been reached. You know, and for meaningful interventions, sometimes it's not going to be the case that you're reaching vast amounts of people, but it might just not be evident to you that you've had an impact on a few individuals who then have a ripple effect within their family or larger systems. But you don't necessarily get that feedback or get to report on those things when you are in a more preventative space rather than a treatment sort of a space. So I think that's something it's extremely important to start doing, but comes with its challenges, and the challenges do not negate the necessity of doing prevention and promotion work.
Yeah, I think something that I picked up through my training in education is a sort of growth mindset to ask questions. And whenever I have a staff member or a student that's interning or that we're mentoring, or the philosophy we take when we help people is that the time I have with somebody or the time they spend on a resource that I build or provide is limited. But that person, if we can inspire in them the desire to learn more, to ask more questions, to invest in their own care and self-development, the 5 minutes that I have with them can turn into, or with you or any care provider, can turn into a lifelong pursuit of trying to help themselves and take responsibility for their own care. And responsibility is a hard word to use when we think about young people because they have such vulnerabilities. But the reality is that changing and fixing society overall, like you can't just click your fingers and people aren't going to experience poverty or trauma or hardship or whatever. So it's working together to try and minimize those things across the board, but building people to ask the right questions, to take the right steps to access the care that they need. And we've had some amazing questions here, and one of them that popped up on Instagram was around, are men less likely to access care because of stigma and attitudes and whatever? Yes, the answer is yes. And that's the thing, is every group, whether you're LGBTQ plus, or you're a man, or you're a young person, or you're an elderly person, or you're a woman, or every group has different risk factors and challenges that they face that are super individual and contextual to them. And I believe that society as a whole is moving in the right direction to create the resources and the services and the support that anyone, regardless of where they come from, can flourish and can become as healthy and well as possible and improve their quality of life. And that there unfortunately isn't one silver bullet to that. It's going to take lots of this, lots of webinars, lots of discussions, lots of asking hard questions. And there's lots of hard questions that people are asking, and as I said, we'll answer them in the comments. And yeah, I just want to sort of wrap up there and say it's been amazing having you on, Wiehan. It's been an absolute pleasure, as well as thank you very much to our guests for attending. We love to share in the learning together. We're still learning and growing. So yeah, thanks again, Wiehan.
Such a pleasure. Thanks for having me on, Daniel. And yeah, thanks to everyone who's tuning in and listening. Just, attending a webinar like this, it shows that sort of curiosity that Daniel was speaking to earlier as well. I think it speaks to that curiosity of wanting to try and understand how we can create a more safe and meaningful environment and connections. And I think that's wonderful. So yeah, thank you. And do not underestimate the power of just attuning to someone and being present. Just really being present with people is, I think, immensely healing in itself.
Yeah, thanks very much. Please do reach out to Wiehan and I if you have additional questions. Please go check out Psyche Innovations if you'd love to learn more about what we're doing. Thank you very much, and we will see you in the next